Emma, you might be surprised at how many Souls cadets there really are around the place.
Oh, is that you as well? Yeah. Well, so
who was it that escaped?
Oh, sorry. Well, I mean, they sold out of their pharmacy a little bit before. But so my friend Amanda, we went to Sydney Uni together, and she was a Souls cadet, and had always, that was the thing from the day I met her, and people have certain kind of aspirations, and it was always I want to be able to then, in my community, to be able to provide a certain type of pharmacy which has this type of service, and to see someone like her take a break, and there's other circumstances involved, but it does really make you pause and reflect.
I don't know whether you'll have time to hang around for when I talk, but we rebuilt our pharmacy last year.
Right.
So we moved twice last year and built a brand new pharmacy. So that was a little tricky.
It was your COVID experience, Curtis.
It was our COVID experience. And through all of that, I ended up needing a bit of mental health coaching myself. So that's primarily why I'm here and why I'm involved in PSS as well.
Well, and I think that's the thing is, we're not live, are we, Curtis?
Don't ask me.
Don't ask you. I can't see everyone. I can only see myself. I don't know why that is.
Thanks, Jenny. That's great. We are live, Emma. And good morning, Jenny.
We might kick start. Good morning, everyone. My name is Abby, and I am a multicultural ambassador of the Mental Health Foundation Australia, as well as a pharmacist myself. We begin today's proceedings by acknowledging the traditional and original owners of this land, and I pay my respects to their elders past, present, and emerging. I also extend the same respect to any Aboriginal or Torres Strait Islander peoples here with us today. On behalf of the Mental Health Foundation Australia and our chairperson, Mr. Vasan Srinivasan, I would like to welcome and thank each and every one of you for attending our Pharmacists Mental Health Symposium. National Mental Health Month is the initiative of the Mental Health Foundation Australia to advocate for and raise awareness of Australian mental health as a community. The MHFA's National Mental Health Month is unlike many other mental health awareness campaigns. It aims to bring together all Australians in a nationwide conversation about mental health, and we aim to maintain this conversation for an entire month and beyond through a series of various mental health related events. National Mental Health Month is a program that the Mental Health Foundation Australia is extremely proud of, and we intend to reach out to and educate as many Australians as possible to help reduce stigma and facilitate positive and non-judgmental discussion surrounding the important topic of mental health in Australia. With 1 in 5 Australians experiencing a mental health illness, it is time we give mental health its due attention, and that is exactly what the MHFA is wanting to achieve. Throughout this month, many events have been organised in each state and territory of Australia, aiming to attract and unite Australians of all ages and backgrounds, to raise awareness of the need for better mental health for all. This year's theme of National Mental Health Month is post-pandemic recovery challenges and resilience. This year's theme will focus on raising awareness about mental health in various industries and communities. Each individual has faced, and many are still facing, unprecedented challenges due to the COVID-19 pandemic. With this theme in mind, we aim to extend our campaign even wider than previous years, with events planned to embrace many different community groups and people of all ages walking on the road to recovery and fostering resilience. Please join us in celebrating the Mental Health Foundation Australia by viewing a short video.
Hi everyone, I'm Vasan Srinivasan, Chairperson of the Mental Health Foundation Australia. It's a privilege to lead this wonderful community-based mental health organisation in its 91st year of establishment. The MHFA has grown strength to strength over the past few years, with Victorian Mental Health Month in 2018, the National Mental Health Month occurring in 2019, 2020, and this year in 2021. Last year, COVID-19 did not stop us from achieving our National Mental Health Month campaign. I'm proud to say we successfully shifted many events to a virtual platform, very much being able to pursue our objectives of raising awareness and advocating for better Australian mental health. Our primary aim is to reach out to and educate as many Australians as possible, to help reduce stigma and to encourage constructive and non-judgmental dialogue on Australia's critical mental health issue. The highlight of last year's campaign was reaching out to 100,000 Australians all across the country for our national walks for mental health, both virtually through our MHFA app and physically in some states. What a grand success that was. In 2021, with pandemic still affecting many of us, we decided not to give up once again, curating a carefully chosen blend of virtual and physical events for Australians to participate in. This year, we have a new and improved MHFA app, giving people the opportunity to participate in National Mental Health Month from the palms of their hands. This year, theme is mental health and post-pandemic recovery challenges and resilience. Mental Health Foundation Australia is proud to partner with Australian technology business DB Results and take up the wellbeing app Am I OK? to support our members, enabling individuals to regularly check in on a private and secure platform and ask the question, Am I OK? Am I OK also alerts the user when it's time to seek outside help. We thank DB Results for this opportunity to promote well-being and early intervention. This year, we have launched a special initiative, the Mental Health Appeal on the 10th of October, our World Mental Health Day. Through this, we aim to raise funds for the development of a course promoting life and safety in young people. At the MHFA, we pride ourselves in making sure all our programs are for the community and powered by the community. We have a vast growing network of multicultural ambassadors, youth ambassadors, and future leaders who further the community voice in promoting mental health and well-being. Our multicultural network has inspired our educational and multicultural webinars as an initiative to assist individuals cope with success during the pandemic. I would like to take this moment to thank our board directors and patrons, scientific advisory committee members, our wonderful staff, multicultural and youth ambassadors, future leaders, MHFA members and major sponsors for their continuous support to our organization as we continue to work to deepen understanding of the importance of mental well-being and educating the community. Let's work in solidarity for the benefit of our mental health. Thank you, Australia.
I would now like to invite Mr. Mike Hutton-Squire from Australian Unity. Mike joined Remedy Healthcare in 2012 and became Executive General Manager in 2018. Mike's prior experience has been as a senior leader in both the UK and Australia across multiple industries, including legal, finance, public relations, technology, insurance, aged care, pharmaceutical, and healthcare. Mike is experienced in strategic and operational management of multi-million-dollar projects and P&Ls, with a strong focus on operating margin and revenue growth through people, process, and system redevelopment. Mike has been responsible for multiple business acquisitions, integrations, large dispersed workforces, and has a keen understanding on how to successfully operate, optimize, and grow business operations in rapidly expanding industries. Please join me in welcoming Mike.
I'm sorry, Mike, could you please turn on your video?
We might be having a little bit of technical difficulties with Mike, so we might pause and come back. I would now like to invite Ms. Emma McBride to provide today's opening remarks. Emma is a Shadow Assistant Minister for Mental Health and Careers. Emma was formerly the Chief Pharmacist at Wyong Hospital and the Deputy Director of Pharmacy for the Central Coast Local Health District. Please join me in welcoming Ms. Emma McBride.
Thank you, Abby. Thank you so much for inviting me to be here today for this really important National Mental Health Month Health Symposium. As Abby said, I'm Emma McBride. I'm a pharmacist. I'm an MP and have the privilege of being responsible for mental health and for carers. I'd like to start by acknowledging the traditional owners of the land where I'm joining you, the Ngunnawal and the Ngambri people, where I'm at Parliament House in Canberra today, and to pay my respects to elders past, present and emerging. I'd also like to thank the Mental Health Foundation Australia for this really important symposium focused on pharmacists, mental health and wellbeing. As I'm sure everyone is aware, October is Mental Health Awareness Month, and we have so much to thank the Mental Health Foundation Australia for their advocacy, for their leadership in raising the profile and the prominence of these really critical issues. And today, focusing especially on the impact on pharmacists. The past few months have been incredibly tough on all of us, but they've been especially tough on pharmacists. Pharmacists have been on the front line of Australia's COVID-19 response, and you've played a crucial role in the vaccine rollout, in community pharmacies, in vaccine hubs, in hospitals. You've faced global supply chain disruptions and local outages, and this has had a serious impact on you, on the demands of pharmacists. The demands on pharmacists have always been high, but this has only been amplified through COVID-19. From listening to friends and colleagues and people that I trained with, you've had to contend with the fear of becoming sick yourself, especially early in the pandemic before there was vaccines and when there was shortage of personal protective equipment. You've also then had with that the fear of taking the virus home to your households, to your families and loved ones, while you're on the front line protecting our community. The concern that you might then be taking this home to your family. You've also faced public panic, whether it was with supply outages, global disruptions, personal protective equipment, masks, crucial medication. Early in the pandemic, many people will recall that infant Panadol was in short supply, and in my community, people couldn't get a Ventolin inhaler. You've had to contend with people's anxiety, and sometimes the way people express that anxiety or their distress towards you as a pharmacist, whether you're standing in a dispensary or you're in a consult room or you're in a hospital ward. And as pharmacists as well, the constantly changing rules that have meant that you have had to comply with yourself, that you've had to introduce within the settings that you work, whether it's a hospital or a community pharmacy or an aged care home. And when you've then had to also try to be able to explain and reassure others as the rules and the response to COVID is constantly changing. And the other part of that I thought was important to touch on today is sometimes the abusive behaviour. And I think that, you know, pharmacists are such trusted healthcare professions. You're the first person that people go to for reliable, up-to-date information and advice. But in times of confusion and uncertainty and panic, you can also be the first person that someone goes to where they express that their concerns or their grief or their distress in a way that has a toll on you. And the thing that I wanted to focus on today is, I've been doing some volunteer vaccinating myself, and I was able to join the vaccine rollout last month at a local pharmacy in Camel on the New South Wales Central Coast. And to Rob King and Tim Holt and the pharmacy team there, and to Rachel Foley, the pharmacist, the nurse immuniser I was working with, they're doing a brilliant job. But participating in the clinic that day, and the people that I heard from who were worried about, you know, if I didn't get a jab today, I won't be able to go to that job interview, or if I don't get this jab today, I won't be able to go and visit my mum in aged care, or you know, when can I have my next jab because, you know, school's going back and I need to make sure I'm protected. And as pharmacists, you've dealt with that each and every day throughout the whole of the pandemic. And as pharmacists, we feel that we should be able to cope. That we should be able to support our communities, because it's what we do. But when you find yourself in a situation of where the demand is so high and the situation is changing so quickly, and you're trying to grapple with it and grasp it yourself, that's when things can become really difficult. And that moral injury of caring and not being able to help I know for pharmacists, they feel it profoundly. But the one thing that I did want to really emphasize today, and something that I hope we can overcome, there has been, I think, many changes in our society and welcome being able to talk about mental ill health, anxiety, depression. But I think the one thing there, and I think we are making inroads into reducing stigma across society, but I think amongst healthcare workers and healthcare practitioners, there's this self-stigma, this stigma that we feel that we ourselves should be able to cope, that we should be equipped with the resources, the knowledge and the expertise to be able to get through. But what I would encourage everybody to do is to be able to when you do need help, to seek that help, and also to be able to have those open conversations with others about seeking help. And these are conversations that I've had with many pharmacists, friends and former colleagues of mine. And, you know, I mean, pharmacists are just so critical to not just to our healthcare system, to our communities. Pharmacists often, you know, in some situations can be the only healthcare practitioner in a particular community. And you're the person that somebody can go to without an appointment, that they can walk in and that they can have this conversation with. And this year's theme of World Pharmacists Day, which we all marked back on the 25th of September, was a pharmacy always trusted for your health. And I'd like to just say to all of the pharmacists listening today, that despite the challenges that we face day to day, despite the surge in demand and some of the obstacles that we aren't able to deal with ourselves, that the community does trust you, that Australians, you know, living in big cities, in small towns, in the bush, trust you. You are the trusted source of reliable information and advice. And I would like to just personally thank you for the work that you have done on the front lines. And I would, in doing so, like to also acknowledge the demand that it's had on you. And I would like to see more support for all healthcare workers on the front line to be able to support us in caring and helping for others. So to all the pharmacists listening today and to all of those who are joining us, thank you for the work that you do. I know the demand is always high, but it's been exacerbated through COVID. And I would like to know that, I'd like you to know that you remain trusted, that our community relies on you. And I know that has a big toll on you. And I'd like to make sure that you check in on one another, like I've done with my friends and pharmacists, former colleagues, and make sure that they are okay and provide that really genuine support and link people in with services when they need them, so that we as a profession can help overcome that self-stigma, which is sometimes a really big barrier to pharmacists seeking the support they need. So thank you so much for the chance to join this symposium today. Thank you so much to the Mental Health Foundation Australia for hosting this really important event. And thank you to everybody who is participating, and especially to the Pharmacist Support Service for the critical work that you do as volunteers in helping and supporting other pharmacists. It is invaluable that people can go, that they can trust that it's confidential, that it's reliable, and that someone else who knows and gets it is going to be on the other end of the line. So thank you so much for the work that you do. So thank you, everybody. And I really, on behalf of every MP and Senator in the Parliament, I just want to express our gratitude for the work that you do today and always. Thanks very much.
Thank you so much, Emma, for your support. We will be posting to you a token of our appreciation. We really appreciate your time today. We now have Mike Hutton-Squire, so I'll pass it over to Mike. Thank you.
Thanks, Abby. Apologies, we had a few tech issues there, but those seem to have resolved themselves. So good morning, everybody. I would like to just start by acknowledging the traditional owners of the lands on which we're meeting and pay my respects to elders past and present. As I've been introduced, I'm Mike Hutton-Squire. I'm the Executive General Manager for Australian Unity Health Services. I'd also want to just acknowledge the contribution that the Foundation has to the well-being of countless Australians over many, many years, and for bringing us this fantastic mental health month each year in October, where we support the Foundation with a range of events organised to foster that community resilience as we navigate our way out of the pandemic and towards good mental health. It also presents opportunities to promote activities and ideas that can have a really positive impact on our daily lives and the lives of others, and to connect and speak about important issues such as today's Pharmacists Mental Health Symposium. For us, pharmacists have a strong primary healthcare role, and due to the accessibility, are often the first health professional contacted by a consumer with a health concern. 1 in 6 Australians receive a mental health related prescription each year, and almost half the population is said to experience a mental health condition in their lifetime. Consumers with a mental health illness commonly have multiple mental illness comorbidities, and they also have significantly poorer physical health than the general population. Pharmacists may see consumers with a mental health condition more regularly than any other health profession, and have a unique opportunity to provide support to consumers in managing their well-being. Good mental health is vital to our well-being, of course, and at Australian Unity, well-being is at the heart of everything that we do. 20 years ago, we conceptualized the idea of a national index of well-being that could be used to track social progress in Australia. It's called the Australian Unity Wellbeing Index, and it has been influential in shaping public policy and providing guidance for governments and other organizations on how they can contribute to improving individual and community well-being. So 2 decades of research now has shown that the secret to happiness boils down to 3 things that we call the golden triangle of happiness. And they are good personal relationships, financial security, and a sense of purpose in life. So we use the Wellbeing Index as a guide in everything that we do, from the products and services we deliver to building real well-being for all Australians. Australian Unity is a diversified organization, and I'll just give you a few examples on how we support emotional and social well-being across a range of services. One of our subsidiaries is Remedy Healthcare, that has been providing its MindStep mental health program to more than 2,500 people now. And it's built around low intensity cognitive behavioral therapy. And it's a 6-week phone and internet-based program that empowers participants to manage their mental health on their own terms and in the privacy of their own home. And what we've found over that time is more than 60% of MindStep participants have recovered from anxiety or depression within 3 months. And that's really a fantastic testament to an evidence-based intervention. And then earlier this year, in conjunction with Australian Unity's Indigenous services, we launched a culturally sensitive adaptation of the MindStep program called Healing Minds. This coaching program is tailored for Aboriginal people, developed by Aboriginal people, and delivered by Aboriginal coaches. And now plans are now underway to adapt the Healing Minds program for Australians from culturally and linguistically diverse backgrounds too. This year, we also announced a new mental health partnerships with the Tasmanian Primary Health Network, as well as the Healthy North Coast Primary Health Network, to deliver early intervention for people at risk of mild mental illness. These government-funded services will support people with anxiety and depression and people experiencing isolation, in particular those in rural and remote locations, and people affected by the pandemic-related isolation and bushfires. These services could never have come at a better time. And our thanks to the federal and local government for funding that. Within our aged care operations, Australian Unity's home care services started developing comprehensive goal-oriented well-being plans with its customers. And these are evaluated and revised annually to help individuals with their well-being goals. And this is just another example of how we really support the social and emotional well-being. And in our built form portfolio of residential aged care facilities, 5 of our current 7 aged care homes are designed, built, and operated to bring to life the 4 elements of what we call our Better Together model, which features a strong focus on health and well-being, the modular small household floor plates, and greater consistency of staff rostered to each household. This is a model that's consistent with the Aged Care Royal Commission's recommendations that good design in residential aged care should involve smaller, lower density congregations. So Mental Health Month, in closing, Mental Health Month is an important opportunity to raise awareness about the impacts of mental ill health and the range of supports available that can improve our sense of well-being. Australian Unity is a company founded on social values and community contribution. We're committed to building and promoting positive mental health strategies. So my thanks to all of you today, and I look forward to an interesting symposium on the important role that pharmacists have in good community health, and in particular, good community mental health. Thank you, Abby.
Thank you, Mike, for being with us here today, and thank you so much for Australian Unity's support. I would now like to introduce Danielle Pericopa, who has sent through a pre-recorded message. Daniela is the General Manager of Marketing at Chemist's Own. Please join me in viewing Daniela's address.
Hi, my name is Daniela. I'm the Head of Marketing for Chemist's Own at Aritex Pharmaceuticals. Chemist's Own is an Australian-owned, trusted brand and community pharmacy for over 25 years. We're proud to be partnering with Mental Health Foundation to promote better mental health in local communities around Australia, particularly with our dedicated customers, our pharmacists, who are integral in providing support to their local communities every single day. This year's theme of post-pandemic recovery challenges and resilience will no doubt resonate with individuals, families and work teams, as we've all personally and collectively been impacted one way or another over the last 18 months. This extends to our customers on the front line who have been constantly under pressure to continue to serve their local communities during the pandemic, with issues including stockpiling, medication shortages, and continuously providing health advice and service to customers. If there is anything this pandemic has shown us, it is resilience of the community. However, what is crucial today is the promotion of non-judgmental discussion around the importance of mental health, and the mission of this foundation to support these discussions and champion positive mental health is a matter Chemist's Own supports wholeheartedly. We thank Mental Health Foundation Australia for recognising the various vulnerable communities in Australia and dedicating events to professionals, including the discussion of mental health for pharmacists, acknowledging the vital role pharmacists play in our community's response to mental health issues and recognising the increasing vulnerability they face due to their profession. Lastly, through the annual Chemist's Own Help Us Help Our Local Community campaign, participating pharmacies will nationally come together to support this foundation with us and their local community through the sales of Chemist's Own until December. Thank you.
Thank you, Daniela, for that wonderful message and for Chemist's Own support. I would now like to invite Vanitha Dahia to speak, who is a naturopath and pharmacist. Vanitha is a passionate specialist in both the fields of nutritional and environmental medicine. She has an extensive experience as a pharmacist in both conventional and integrative medicine, and has worked in community and hospital pharmacy, as well as the pharmaceutical industry in Australia and South Africa. Please join me in welcoming Vanitha.
Hello there. Thank you so much for this opportunity to be part of this amazing event. Abby, I have some slides. Would you like to pop them up? Great, fantastic. Thank you. So do I just go ahead and mark them forward and backwards as I go along? Yeah, okay, excellent, fantastic, thank you. I'd like to acknowledge the people of Australia, both Indigenous and Australian, who have are all challenged by mental health in this very important month, the Mental Health Week, or Mental Health Month rather. As the previous speakers have reiterated, the burnout, the workplace behaviours are amazing challenges that most pharmacists are having to deal with. There seems to be an asymmetry of engagement between pharmacists and their staff, as well as pharmacists and the community at large. They are having to be exposed to heightened levels of pressures and demands and stresses, and there's really palpable emotions and often aggressive and intimidating behaviors with not only within the pharmacy team but also the community, as issues of vaxxers versus anti-vaxxers, and pharmacists are exposed to all of this, particularly those pharmacists that are working within the vaccine scenario. They might be exposed to patients who are not fronting up for their appointments, or they might have aggressive opinions about being an anti-vaxxer. And then there's also the constraints of border crossings or shortage of locums or, employees, interaction between the stress components between employees, and particularly also office workers. Now there's a huge issue of whether one has to go back or to work or not, etc. So as a result of this, it's creating, of course, over the last 2 years, 18 months, physical and psychological fatigue has been significant. And of course, we need to have strategies to ensure that we can actually move forward. So as a result, shall we, I'm not sure how I can move this forward. Abby, are you able to move to the next slide? Sorry about that. So obviously the profession is spiraling into burnout and job dissatisfaction. There's many, many pharmacists that are actually leaving the profession purely due to stress, and it's wearing them down. Patients, pharmacists are being accused of wearing chin masks, or customers that have not been wearing a mask, for example, and that creates a lot of issues in relation to PPE adherence, and everybody has a right to feel safe in their workplace. So some patients or some customers or staff might feel threatened or feel very uncomfortable. So staff are feeling really exhausted, they're feeling undervalued and unsupported. And really, this is adding to the tipping point. And obviously, this then leads to victim blaming, and there's a lot of negative energies. And of course, if you have somebody, just a staff member who is negative, it's contagious. This contagion is in actual fact very demoralizing for the workplace productivity and also atmosphere of the particular workplace. Next slide. Sorry. So the problem is really, really big at the moment. As a matter of fact, Emma McBride spoke about how wonderful pharmacists were. And of course, pharmacists are probably in the forefront of all health services. They are out there in the community. But unfortunately, the latest global trustworthy ranking puts doctors and scientists and teachers right up the top, and pharmacists didn't even feature in the first 15 or 20. So the Healthcare Complaints Commission in 2019-2020 saw an increase, up to 80% increase in complaints about pharmacies. And this is quite significant. However, at the same time, there's been internet searches for stress and sleep issues have skyrocketed to 4,500%. That's huge. Everybody's looking at some option available to them. As a matter of fact, a survey of close to 300 healthcare workers showed that 4 out of 5 people reported with an increased level of stress. And these statistics are huge. They are absolutely huge. 57% have problems with their sleep. And in a pharmacy setting, we have exposure to a number of opportunities to consider when we're looking into their particular health issues. So we're needing to not only support our staff, but also our clients as well. Next one. Now, this issue is not only confined to a community pharmacy setting. The hospital setting is a huge stress ball, because people are dealing with really high stress, life and death situations. It's a 24/7 environment where the pressures on beds or pressures on pharmacists having to wear multiple hats, whether they're doing TPNs or whether they're doing ward rounds or whether they're doing dispensing. And within that stress, there's also bullying. There's also hierarchical organization. So it's a very competitive environment, and it's a high achieving environment, and it's a very time sensitive environment. So you'll have patients who are becoming really demanding. So what do we do about it all? Next one. So what we need to think about is, how are we actually needing to protect ourselves as pharmacists, and how can we then invest that protection in not only our pharmacy staff or our team, but also the community at large. So it is important to take time out and slow down and possibly think of mindfulness procedures, mindfulness meditation, or things, activities that bring one joy. So it's a really good idea to actually get patients or people that you're dealing with, whether it's staff or whether it's clients, to actually think about their life in various forms of weighted buckets, for example. So if you might get a bucket that is filled with work, a bucket filled with family and friends, recreation and personal growth and so forth, and get them to color it, and so that they can actually identify the need to actually develop strategies to actually lower the levels in one bucket and increase the other bucket. And this will, it's so that people can actually start to prioritize their energies to fill a bucket to create more balance. Next one. And so that enables us to really support our team as well as the communities. We need to pick up these signs and symptoms of mental ill health. And this can be achieved very easily from a pharmacist perspective, not only in, it's really, really hard being a pharmacist in charge as well as supporting the entire team. So having strategies available would make all the difference in terms of being able to change a negative environment into a positive environment, to be happy, to be productive, and to minimize the burnout. And so strategies need to be taken into consideration. We've got to learn to actively listen without any interruption. Use some form of empathy and build a rapport, whether it is with your team or whether with your client. So it's sometimes we need to know when is the right time. Do you refer a person to a CAT team? When do you refer a person to or call up an ambulance? A simple event where a patient has been in a vaccine pharmacy. Upon provision of the vaccine, he had to wait for his 15 minutes and he was shaking, was obviously really anxious. But the poor pharmacist was panicking because everybody around that particular patient was creating an environment of an adverse event happening. And this then leads to such severe pressure at the time. And it took another pharmacist to come in and isolate that particular person, call up the ambulance, etc., so that the procedures could continue. So this therefore requires action, but at the right time. So that, and also knowing also when to refer a patient or a team member to a GP or to pharmacy support services, peer support services as well, or even consider phytotherapy. Now, there's some amazing opportunities. Every pharmacy has a range of phytotherapeutic options. To be familiarizing yourself with these options that can be used, evidence-based options that can be used quite effectively as either adjunctive therapy to help with sleep or stress or anxiety. And there are these opportunities available. So one needs to actually develop time for self-reflection and personal development and really develop those soft skills for, I guess, what we call emotional intelligence. Next one. So what are the operational protocols that we can think about? We need to actually, if in a large pharmacy, we need to think about segregating various teams so that if one needs to isolate, we actually have another team to actually take it on board. Now, as we're moving out of lockdown, these restraints are not as important, but we have the potential to go backwards again. So we need to actually have these operations in place. We need to properly consider changing workflows so that we are triaging and minimizing the contamination of either stock or people, etc., and change the operational protocols. So we might need to consider, are we going to sign scripts or not sign scripts? Or how are we going to perform deliveries? How are we going to split shifts, etc.? And we need to think about how to regroup and actually develop a sense of connectedness, to develop strategies to ensure that these operational protocols are actually maintained and confidently allow for potential psychological and physical calm. Okay, so we need to probably consider issues associated with financial insecurity, and then there's also this is a very big issue, the whole issue of vaccine hesitancy. So it's really important. Pharmacists are actually talking about spending oodles of time on the phone trying to strategize the concept of how important the vaccine is, and particularly for those that are vaccine hesitant. And they're spending all of this time where that time should actually be spent referring to perhaps another mechanism. So these guys are obviously looking at all the various media and social representations, and the pharmacists are the interface of having to actually sort these things out for them. So this is an opportunity for you to perhaps refer to a GP. Next one. So we need to think about strategies to really de-escalate these emotions. And because we are the first point of contact, that is so critical to stay engaged, to ensure that you've got to keep validating the client or your staff. You've got to be aware of your own. This is most important. It's all you're giving of yourself all the time. So you've got to be aware of your own mental health challenges and remain positive in destigmatizing. You've got to normalize to the effect of reaching out for help, because mental health is a huge issue. So you might, within a pharmacy, you might want to promote breaks or time out to connect or re-energize. But you know something, the biggest return on investment is just to ask somebody straight out, whether it's a staff member or a customer, are you okay? Engage with compassion, listen. And that is so important, because you can express all these various webinars and various resources that are available. But unless you actually have that one-on-one connection with your staff member or with the client, you would actually, that return on investment provides creativity and productivity within that environment. And so finally, next one. PSA have guidelines available, and it's really aiming at implementing, reviewing mental health meds. You can look into pharmacogenomic testing. So this is actually identifying, are these pharmaceutical meds for my mental health ideal for me? So you can actually look at your genetics, and so that testing is available, looking at your genetics and matching up your gene profiling to the right drug. Because not everybody can respond well to an SSRI. They might need other mood stabilizers, or they might need other agents to help with their mental health. We've got to support the frontline pharmacists, particularly where it's most critical is in the rural and the remote regions. Often some of these pharmacies are in actual fact family pharmacies. So if one person is perhaps impacted by COVID, the whole pharmacy has to shut down. And there's such a shortage of pharmacists as well as front shop staff in these remote regions. So we might need to be, putting our hand out to actually help some of those pharmacists as well. Support people in mental health in these crisis situations. And the mental health first aid training is an initiative that is out there. These provide tools to help with really complex situations, and give us pharmacists tools. We're not the doctor involved. We're not the psychologist, but we need these tools to be able to further refer on to patients. And finally, there are many, many resources available. Next one. So the pharmacy resources that are available, of course, is pharmacy support services. This is a peer support group for pharmacists, pharmacy assistants, students alike. And they are all the volunteers, pharmacy volunteers, are in actual fact peer support. They provide peer support and telephone counselling. Then there's also the National Health Commission. Obviously, Mike spoke about a few other organizations as well. The National Health Commission is a government agency, and they are involved in reporting on mental health and developing policy advice, etc. But they also have the opportunity to provide pragmatic tips and tricks, as to how to look after yourself. It provides guides for various businesses and help maintain good relationships at work. So there are many strategies out there. And as pharmacists, I think we all need to tap into some of these resources that are available, but also keep a positive mindset and help put the hands out and ask our staff as well as our clients if they're okay. Thank you so much for listening.
Thank you, Vanitha, for being here today and your support. Really appreciate everything you said. I think something in particular to take away was asking if you're okay and how important breaks are, because if you're a solo pharmacist on a weekend, often you don't really get a break. Or if you're in a rural area, you might be the only pharmacist, so you can't really take that time away to look after yourself sometimes. And I also do want to say that the Mental Health Foundation Australia does mental health first aid training. So if you're interested, you can have a look at our website for dates. Thank you again, Vanitha. I would now like to invite Curtis Runau. Curtis is the Pharmaceutical Defence Limited New South Wales Director, the PDL representative on the Pharmacist Support Services, as well as a partner in Emerton Pharmacy. Please join me, in welcoming Curtis, who will be sharing a personal story with us today.
G'day, everybody. Yep, look, and thank you for the opportunity to talk about what it's like actually on the front line. As Abby said, I'm a pharmacist. I'm PDL Director for New South Wales ACT. I'm the PDL representative on the Management Committee of the Pharmacist Support Service. And with all of that, I have also done, obviously, mental health first aid, as so many of us have done. And I've done the Pharmacist Support Service volunteer training. Not because I'm a volunteer, I just simply don't have the time to be a volunteer, but I wanted to understand the training that the volunteers went through, so that if I was on the management committee, obviously, I feel like I can help the volunteers better if I understand the training they've had and what they do. So let me talk briefly about the PSS volunteers training. It's 2 full days plus a bit of pre-work, and a quarter of that time, so half a day, is actually spent on talking to people about suicide. It's a really difficult thing to talk about, actually saying to somebody, have you been thinking of suicide? And it's something I've been doing here in the pharmacy for, I don't know, probably 10 or 11 years now. And it is a very difficult thing to do. And the first time that I did it was a patient who was starting off on a new medication, antidepressant. And I said, have you been thinking of suicide? And they dissolved into tears on me. And I said, I'm so sorry, I didn't mean to upset you. And they said, no, you haven't upset me. I actually think you're the first person I've spoken to who actually gets how awful I feel. And that was a really difficult conversation to start, but a really rewarding one. And we don't need to have all the answers. I'm one of my favourite things of saying is I don't know who has all the answers, but I know it's not me. So we need to make sure that we get as many people and use our brains trusts and our friends groups as much as we possibly can to get those answers out. So to our personal experience, and we moved into some brand new premises, which you can see behind me. We moved out of our long-term pharmacy in March last year. Now, if you remember, March last year was when all of us were really dealing with people stockpiling, with stock shortages. And as Emma mentioned before, I never thought as a pharmacist that I would have to say no to anybody who wanted a Ventolin. Yet I didn't have stock. I simply didn't have a way to say yes to everybody. And that was deeply troubling to me. We instituted sneeze screens. We have masks, we have eye protection. I've spent my whole life as a pharmacist trying to get closer to people. And yet here we are in the middle of a pandemic, and I'm saying no to people for things that I know are life-saving. I'm getting further away from people with masks. They can't read my face, I can't read theirs. And all of that was deeply troubling. And in the middle of that, we moved our whole pharmacy, only 70 metres, thankfully, but the whole pharmacy moved. We spent a month after that trying to find where we'd put everything because, of course, in the middle of March, when we were dealing with all of this, we didn't have the time to neatly put everything in boxes and mark them and label them and transport them down bit by bit. So we spent a month trying to find where everything was. And we had done a few things. I remember the day, it was the 18th of March. That particular week, our prescriptions had spiked as they had for everybody. And we were setting records for a Wednesday. And I remember my wife, Margaret, who's a pharmacist as well. I was out on the front in the middle of the pharmacy on the shop floor. And I was actually working as a concierge, just trying to keep everybody calm, saying, Lucy, your script is done. And, Paul's got your script. He's going to bring it out to you, or just trying to keep everybody calm, keep our staff calm. And I remember Margaret saying to our staff in the dispensary, stop, everybody, just slow down. This is not safe to continue working like this. We need to make sure that what we're doing is safe for us and safe for them, and they're just going to have to wait. And I could see all of our staff, some of whom were just newly registered, take a deep breath and say, you're right. We need to do this safely. We need to do this well, and we'll get through these days one day at a time. And it was just off the cuff, and it was some of the best leadership that I've ever experienced was Margaret saying, stop right there. We then had to design a brand new pharmacy, and we designed a brand new pharmacy from scratch. We'd been working on it for a while, but of course, all of the important stuff happens in the last few months before we actually moved into the new pharmacy, which happened on the 9th of September last year. So again, right through the middle of 2020, we were designing a brand new pharmacy. And I remember we were about 2 weeks from moving into the new pharmacy. We're waiting for the approvals to come back from the various authorities. And if we don't get the approvals, you get one shot at that. If you don't get those approvals, you then can't trade for a number of weeks afterwards. And so the pressure is right up to here, and something went wrong. And it doesn't matter what that one thing was that went wrong, but it was a pretty big thing. And I personally started spiraling. I couldn't stop thinking there was this one problem, and it was going to derail all sorts of things, different links in the chain that were going to be derailed by this. And I know I've got plenty of mental health training. I know that if you can't be calm, then you're not going to make good decisions. But the way I describe it was I'd run out of tools in my mental health toolkit. And so I needed some help. So I needed to reach out, and ended up getting some counselling myself and getting some more tools into the mental health toolkit. And of course, as we know, these things end. That's hard to remember when you're in the middle of it, but these things do end. And it did. And we got through, as a team. But it was very challenging. And so I suppose I'm here today because I'm willing to talk about the fact that I've needed help with my mental health. I often say at this point, when I talk to our patients, you might be surprised at the people who you think have all their things together, who've actually had to talk to somebody to get all of their things together. And I point to myself, and they look at me and go, you? Yeah, me. So it's the middle-aged white man in a country set up for middle-aged white men by middle-aged white men. And I can struggle. And so those of you who deal with issues over race, over gender, over simply not being old enough for your patients to take you seriously, I remember that's really difficult. And so if I can struggle, then anybody can struggle. And I speak because I want people to know that there is no shame in speaking up and saying I've needed help. And at about this point in conversations with people, I say, you know what, if Novak Djokovic and Roger Federer and Rafa Nadal all need coaches to play better tennis, yet they're the best tennis players in the world, what's to make any of us think that we don't need a little bit of coaching from time to time? And so that's the angle that I use, and it strikes a chord with a lot of people. I know nothing that we do works for everybody, and that's something that we talk about as well. But if what you're doing isn't working, then you need to realize that it's not working and try something different and keep going. There is something out there that will make you feel better, whether that's counseling, whether that's medication. And sometimes it's just a sense of connection. It's feeling like we're not alone. And so those of you who've heard me talk before or read some of the things that I've put out will know that at about this time I say check in on somebody. It's the sense of connection that you get out of actually checking in on a friend that can actually make you feel like you're okay. There are some things that I've written about recently, particularly there's one called moral distress, which is where your work, and I noticed there's a question in the Q&A talking about this, and I can hear the moral distress in this. And it's where your work actually prevents you from working in the way that you believe is appropriate for the patient in front of you. And I know the question will be answered later on, but sometimes just knowing that there is a term that describes how you're feeling, and that term is moral distress. Sometimes just knowing that other people have studied it, have looked into it, and actually have a way of describing that can make you feel like it's not hopeless. And if that's what you get out of that, that's fantastic. The other thing is workism. And workism is defining yourself by your job or your role. I am a pharmacist. I'm also a father. I'm a grandfather. I run stupid distances for fun. I'm not a runner. Okay, that assigns a whole level of crazy that I don't subscribe to anymore. And so we define ourselves by our work, and that's okay. But when we don't love our work, that creates a bit of tension between who we are and who we want to be. So there are some things out there, and if you are struggling, speak to people. The awesome volunteer pharmacists on the PSS are just amazing. So reach out, speak to somebody, and realise that you're not alone. Thanks, Abby.
Thank you, Curtis, so much for sharing that journey with us. I think one little thing that you said resonated really with me, which was we all need a little bit of coaching from time to time. And I think it's really important that everyone kind of take that to heart. And, you know, you might not reach out today, but it's a good thing to keep in the back of your mind. So thank you so much for sharing your story with us. I would now like to invite Mr. John Jackson from the Pharmacist Support Services. John has qualifications in pharmacy and public health and is engaged in research at the Faculty of Pharmacy and Pharmaceutical Sciences at Monash University. John has previously owned and operated both community and hospital pharmacy services and is currently the director of a not-for-profit pharmacy in a community medical centre. He is the Vice President of Pharmacist Support Services, President of the Victorian branch of the Pharmaceutical Society of Australia, and President of the West Pacific Pharmaceutical Forum. Please join me in welcoming John.
Hi, John. Could you please
My,
start your video?
my apologies. Can you see me and hear me now?
Your video is off. Could you turn it on?
I am. Can
Yeah,
you see that
perfect.
now? Thank you very much. My apologies. I had not turned off my mute and lost my screen. So thank you very, very much for the opportunity to speak to you today about the Pharmacist Support Service in this very, very important seminar. I appreciate Emma having made reference to the Pharmacist Support Service in her presentation, as have the others today. And my objective in speaking to you today is really to make you an advocate for the Pharmacist Support Service by making you more aware of how and why it was set up. Because the stronger you are as an advocate for the service, the more viable and sustainable the service will be, and the more likely it will be there when or if you need it. So what exactly is the PSS? The PSS is, and there's a couple of words on the screen that I think are important to you, it's an independent entity. It was set up with well-meaning pharmacists in Victoria about 25 years ago, and it's grown to now cover the whole country. It's a not-for-profit entity and it's a registered charity, so it lives largely on the basis of donations. We have a number of members that are member organisations from the profession, and you can see them listed at the bottom of the screen. And this is a strength of PSS. We have engagement from all of the major pharmacy organisations. And if you're a member of one of those organisations, please let them know how much you value your organisation supporting PSS, because it's incredibly important to the sustainability of PSS. We were set up really to provide assistance wherever pharmacists, pharmacy interns or pharmacy students needed it. So what do we do? I know you've already heard a few of these words. We provide non-judgmental support for members of the profession who are experiencing stress and related issues, generally workplace-related issues. That's a frontline service. And if we cannot help with the non-judgmental counselling that we provide, then we can refer people to other services, because we keep a major database of the types of services that pharmacists may need in times of stress. But doing those two things is really sort of addressing an issue that has materialised. What we would like to do is to try to stop these issues materialising to the extent we can by raising awareness of health and wellbeing for pharmacists generally. And we'll talk a little bit about that in a second. Why do we do it? I could almost drop this slide now because you've heard the reasons we do it. On one hand, we work in an environment that is incredibly stressful. And then sometimes we work in workplaces that are not as ideal as we would like for safe and assured working experiences. So there are two things in play here. There's the fact that we need to be accurate all the time. We've got these mandatory obligations and our environment is very challenging. And then some of us, unfortunately, are working in places that are incredibly stressful because of specific workplace circumstances. So some are inherent in the role and others are workplace dependent. And we've got to recognise these two differences and approach them accordingly. How do we do this? As you've heard, we have a telephone service that operates every day of the year from 11 p.m. until early in the morning. And it's available now across the whole country. And it's available to pharmacists, interns and students. That provides readily accessible, anonymous and confidential support. And as Curtis said, our volunteers are all pharmacists. They've all been trained in crisis model counselling and they donate their time incredibly generously to support their brethren, their colleagues, as pharmacists supporting pharmacists. We also have psychologists engaged with PSS to not only provide additional support if and when needed to callers, but most importantly, to support our pharmacist volunteers. Because as Curtis said, taking a call can be incredibly stressful, whether that's being somebody just concerned about their future career, or if it's somebody with the real issue of suicide facing them. Who does call us? Well, not surprisingly, the majority of calls are coming from younger pharmacists. I say not surprisingly because the majority of pharmacists are of a younger age bracket now. However, we do find it's often younger pharmacists who perhaps are missing some of the tools that they need to be able to address stress. So you can see there, 48% of callers are under 30 years of age. 65% of the callers are female, whereas only 61% of the workforce is female. So again, we're seeing here evidence of perhaps a need for greater training in that group. And you can see the distribution between pharmacists, interns and students getting close to mirroring the distribution in the workforce. We do, of course, provide our services with confidentiality and anonymity. And so our data here is limited to what our volunteers can determine by listening to people. We do not take hard data from people. That would breach the principles of confidentiality and anonymity. So why do they call? How do those workplace circumstances translate into problems that people face? It might be something as realistic and identifiable as a dispensing error. But then again, it may just be something in terms of a workplace relationship where there's a difference in power balance, and that may be gender related, and that's causing somebody to be really stressed. It's leading to some form of moral injury or distress. So people call when their identity has been contravened and their sense of purpose has been compromised. What can you do as a pharmacist? Well, in the first instance, I want you to be better aware, hopefully through this presentation, of what PSS is, why we're here, how we operate, so that you can support us and ensure we are here for you or your colleagues in the future. But what can you do in a practical sense about stress in the workplace? Self-care is the most obvious. Being aware, prioritising and ensuring balance in your life. I hear a lot about pharmacists needing to be resilient, developing their resilience. And yes, I totally support that. But that addresses the individual circumstance to a degree. It does not necessarily abrogate the responsibilities for the employer, the person running the workplace, the supervisor. They also have to recognise and comply with their legal and professional obligations to ensure that workload pressures aren't excessive, that there's not a psychosocial hazard in existence that will affect different staff members differently. But we are a very close-knit professional body, I find. And I think one of the most important things we can do is care for each other by being aware and sharing. So I'll leave you with the number. It's been on every screen, 1300 244 910. And we are very active on social media. Please, if you need, reach out. And just in case you might need in the future, offer support wherever you can. Thank you very much.
Thank you so much, John, for being with us here today. And I think most pharmacists will have a PSS magnet on either our fridge at home or one of the pharmacies. So remember that number, do call and reach out if you need help. Thank you again.
Thanks, Abby.
I would now like to invite Tracy Blythe, naturopath, educator and consultant. Tracy is a naturopath of 17 years and has a goal for the community to have greater access to quality complementary medicines, whilst receiving the best evidence-based advice from qualified practitioners. Starting her careers in the early years was spent in health food stores and pharmacy, connecting with, serving and supporting her many patients to find their best health. Tracy then spent more than a decade delivering education in the practitioner and supplement space for pharmacy with the leading supplement brand in Western Australia. Please join me in welcoming Tracy.
Thank you so much, Abby, and thank you for the Mental Health Foundation putting on this event for pharmacists. I have had an incredible hour or so listening to some wonderful presenters. I really appreciate, Curtis, for your personal journey that you've taken us through as well. So today what I'll be speaking about is how you can effectively use complementary medicines to enhance mental health, to support mental health. I suppose it's the another piece to the puzzle. I always describe good health to my patients as being a puzzle. There's a lot of different pieces that come up. I like the buckets idea that Vanita was talking about earlier, to bring everything together that we can help. Complementary medicines are just one of those. And thank you, Abby, for the wonderful introduction. The one other addition, I suppose I'd say, is that I'd like to also acknowledge that I am speaking to you today from Boorloo here in Western Australia, which is on the lands of the Whadjuk people of the Noongar Nations. I also would like to pay my respects to elders past, present and emerging. I am a passionate advocate for the health providers in pharmacy. I'm not going to go on so much about the things that we're all clearly have heard from the experts before me, but my experience in pharmacy as a naturopath, working alongside my pharmacist, is that COVID has made a lot of things, exacerbated a lot of things, but I haven't worked in a pharmacy since 2008, and a lot of these issues were there then that I'm hearing that we're talking about today. So the presentation today is very much a cut down of a longer presentation that I've given a number of times now for helping pharmacists navigate themselves and their patients through increasing rates of mental health distress and therefore increasing use of medication. In the 1920 financial year, over 40 million scripts were dispensed by you pharmacists, that's representing 17% of Australians when it comes to mental health. Nearly 3/4 of those were for antidepressants. Then we have things like our antipsychotics and ADHD medication, etc. But depression is an ongoing long-term problem. It's the leading cause of disability worldwide. When we look at that demographic, with the slides shared just earlier about more women than men accessing the support of the PSS, more women significantly are taking mental health medications as well. We look at those statistics on our older patients, and I'm sure that reflects in the pharmacy for you in terms of the patients who are coming in with their scripts. Australia is second only behind Iceland when it comes to dispensing mental health medication. In Australia, we're considered the lucky country in terms of lots of things that should give us good opportunity for good mental health, yet our medication use suggests otherwise. The last slide on information around the statistics is this one that was commissioned towards the end of the last financial year, when we thought that COVID was going to be a problem of 2020 as opposed to continuing into 2021. As you can see, it's the blue line that is antidepressants, but also anxiolytics and antipsychotics. The significant increase, particularly in the 8 weeks leading to the end of June, that was as the majority of the country was in its first iteration of lockdown. But when it comes to depression and low mood, it's not just workplace stress that are risk factors. These are the listed lifestyle risk factors, those that are can be modifiable. So the top 5, if you like: poor sleep, which a lot of these is what comes first. Is it the chicken or is it the egg? All of these actually are interrelated with low mood and depression. But poor sleep, alcohol or substance use and misuse, particularly when it comes to depression, heavy drinking, cigarette smoking, which is often put to the side when it comes to depression and low mood, but highly linked as a lifestyle risk factor. Diet and lack of exercise. When it comes to diet and exercise, completely interrelated with low mood and depression, to be making poor health choices for food and exercise. Then there's the underlying causes that for you may all have friends who have these underlying, have those, make those lifestyle choices, yet they're chipper as ever. And people that eat the right things, that do the right exercise, that don't drink, don't smoke, and they still experience issues with their mood. As Vanita touched on, there is absolutely genetic links there, which is an indicator for a number of things. But these four: inflammation, mitochondrial dysfunction, oxidative damage, and stress, so the external stressor. What they compromise is a number of things, but particularly in our brain, BDNF production or expression, and then affecting our digestive system, so our gut-sourced neurotransmitters. The reason I've got this slide in is just to highlight that it was actually for the first time last financial year that 2 medications for mood, so both Lexapro and Zoloft, actually reached the top 10 prescribed drugs in Australia. So SSRIs are by far the number one. But then when we look at their effectiveness, which again, we go back to those genetics, it's only about half the patients who are taking SSRIs have the benefit. So even if this is for yourself and you're looking at what's in your mental health toolbox and reaching for an SSRI, half of the time, half the patients within 6 to 8 weeks will have a benefit. So there is potential for benefit there, but it certainly is not the only tool in the toolbox to reach for and expect it to work for everybody. When 50% of people are non-responsive to treatment, we need to look at other things that we can do. And when it comes to looking at other things, first we need to consider if somebody or yourself is taking an SSRI, is their medication leading to a depletion in certain vitamins and minerals. What we see when we look at these depletions is there's actually a common thread with these depletions for those with depression as well. If we go back to the earlier slides, the underlying risk factors of a poor diet and depression, chicken and egg, as I said before, but often leads to a poor nutrient intake. That poor nutrient intake gives rise to increased nutrient depletions in the body. But those increased nutrient depletions are further exacerbated when these here on the list, further exacerbated by the use of medications. So to consider for your patients with what's going on for that patient or yourself as to whether these nutrients, particularly say the vitamin D, would be a high priority to have tested, and then consider nutrients like zinc, as they have a wonderful additional benefit for the outcome of SSRIs, particularly for resistant depression, or for those where depression is associated with magnesium, with pain, which is another thing that often goes hand in hand. We talk about that inflammation side of things, that magnesium has a huge benefit. But when it comes to complementary medicines, what's the top priority to help improve the outcome? There is so much. The reason St. John's wort is not on here is because we're talking about those that are taking medications. St. John's wort is one to consider that has a lot of evidence for benefit on improving mood, but it is absolutely contraindicated alongside mood medications. So these 3 have been shown to be safe in a number of different trials. With systematic reviews, we're talking about evidence-based complementary therapies here. Saffron is one that is emerging these days. There is a lot of evidence that came out of Iran a number of years ago, but it is being replicated again and again, and showing benefit where there is enhanced for those that are taking medication. There is around an equal benefit as an alternative, but then for those where there is resistance, it is significantly improved. Curcumin, when we look at bringing down, how does it work, bringing down inflammation, it is absolutely imperative as an anti-inflammatory when you're looking at complementary medicines, but again, it has that similar response to an SSRI or an increased response for when taken alongside. What else to consider when it comes to complementary therapies is to have good chats with your patient. Ask about their caffeine intake, particularly when there's depression associated with anxiety. It is an under questioned. There's nothing wrong with, I'm not a naturopath that gets everybody off off the coffee, but making sure they're not having too much. Too much is probably more than 2 cups a day for somebody experiencing particularly anxiety. Exercise, 150 minutes of moderate intensity exercise each week, so 5 times through 30 minutes, been shown to have a significant effect. Looking at alcohol and smoking for oxidative damage, ensuring there's a phytonutrient-rich diet to ensure that there are plenty of vitamins and minerals available for that patient, as well as the carbohydrate, fat and protein balance. And then another little one to just consider, particularly for the fact that the higher rates are in women and in women of reproductive age, is check for iron status. The low mood and depression can often be masked by or masking an iron deficiency. I've got a couple of slides in here around interactions to consider when it comes to complementary therapies for your patients who are taking their SSRIs. There are some serious ones that we absolutely need to avoid. Ginkgo and St. John's would be the 2 most common that you would come across. But then these are ones that often are listed as contraindications, but they're absolutely not. What we need to look at is the risk of serotonin syndrome and serotonergic effect. There is a much bigger effect when it comes to lots of different drugs than it is with these nutrients. And these nutrients have all been clinically trialed and shown to be of benefit of patients with SSRIs. In summary today, ask your patients lots of questions. Check in with people. I love the questions, the points brought up earlier about literally just asking what's going on for the patient, rather than making the assumptions and jumping to those solutions straight away. First of all, I've given lots of information here is, oh, I need to give my patients lots of things. Absolutely not. Ask their symptoms, what's going on for them, and try and provide solutions in that, and make sure the recommendations are simple and step by step. You need to minimize overwhelm. We all know if we've been at the bottom of the well of feeling in a position of low mood or depression, that overwhelm leads to inaction. Action comes from small, simple steps to start with. And then use your position as that pharmacist. I know someone said earlier that this is the pharmacy has a greater point of contact than any other healthcare provider with somebody with depression. Use that to monitor progress. Come in and on their first SSRI, suggest them to come in regularly to check in how they're going. And also, I'd like to offer everybody who's here today, if you would like it, the free access to the full presentation of this. This is an extremely cut down version. I have lots of information to share and over 150 references for those who are keen to learn. So please just sign up to the mailing list or get in contact with me on the socials and let me know you want it, and I'd love to share it with you. So thank you so much for the opportunity to present today, Abby. I really appreciate it.
Thank you so much, Tracy, for being here today, and thank you for your putting forward your presentation as well. I think a lot of pharmacists, we don't get a whole heap of training on complementary medicines, but they're so important, especially these days when people do want preventative care and not just pharmaceutical medications as well. So thank you for that.
No problem.
We will now be having our panel discussion about this very important topic with all of our speakers so far. So feel free to put any questions forward in our Q&A box. We do have a few questions that were submitted to us earlier, and you can also reference the particular speaker that you would like to answer your question. So once again, I would like to welcome Vanitha, John, Curtis, and Tracy. And I would like to introduce a further panelist, Kay Dunkley. Kay is the Executive Officer of the Pharmacist Support Services and was named Pharmacist of the Year in the PSA Symbiont Excellence Awards for 2020. Welcome, Kay. All right.
Thank you. It's great to be here and to join you all today. And I think it's such an important topic. And I think that each of the speakers has brought a unique aspect to the story of pharmacist mental health. And just to Tracy's presentation, I think it's also important for us to think about our own self-care, because that is really important. There's a lot of external factors that we can't as individuals control, and putting some effort into self-care is really essential.
Very much agree. And it's really important that we get this conversation going and make sure everyone's got the help they need as both a health professional, but also so we can help people who do need that help too. So we'll start off with a couple of questions that we've had come through earlier that was submitted to us. But the first one is, what are some of the psychosocial hazards for pharmacists and how can they be minimized? And we also had a comment about this in our chat as well.
I'll lead off if you like. I mean, I think we've covered certainly the issues in pharmacy, the pressure that arises in the workplace. Some of that is requirements to abide with the legal sort of impact on pharmacists, and some of it is external. We're dealing with people on an everyday basis, and often people come to us and they are quite stressed. In a hospital environment, obviously it's life and death, a lot of critical issues that arise. So I think there are, multiple, and I think certainly Curtis's story illustrated, an individual's sort of experience very well.
Abby, something worth keeping in mind here is every individual will have a different experience. What is a psychosocial problem for one person and quite devastating for them might just go under the radar for somebody else. So it's very much the personal thing, and you've got to always recognise that. But in general terms, an issue for pharmacists is we have this expectation on us, and one that we adopt ourselves, of accuracy, reliability, trust, and that in itself, in any environment, brings challenge. So I think that underpins some of the psychosocial aspects. Our people come to us with that belief in our reliability and accuracy, but then the circumstance in which we often work, as was heard by other speakers, challenges that when there's massive prescription numbers and shortages and things like that. So it does come down, I think, to that aspect of our work, that we need to be reliable. We adopt that, we live that, and that can sometimes be very, very difficult for us, depending on the individual.
I think that also leads really nicely into a question that was asked in our Q&A as well. I will read it out. It is a little bit long, but as per Pharmacy Board and Victorian Pharmacy Authority, one pharmacist has to see up to 200 patients per shift, and this is our maximum. This means that they only have 1 to 2 minutes per patient, or even a few seconds, because there's always other duties to be performed. So phone calls, doing medication checks, orders, stocking shelves, looking after refunds, document attestation and stat decks. S2 and S3 sales, which is pharmacist prescribing, supervising staff and the pharmacy, and shoplifters and things like that, which come into our retail side. It's a very high number of patients that one pharmacist sees a day. And for a reference, a GP will typically see 20 to 30 patients a day. And if you're a nurse in a hospital and you're on a ward, if you have an individual team, you're looking after a maximum of 8 patients, and you're also sharing that patient load with other nurses as well. So with so much increased activity, there's a real increase for harm as well. What do you think can be done to help reduce the workload? And I think this is one in particular that Emma might be able to answer, but is there something that can be done to help reduce this by influencing the Pharmacy Board or the Victorian Pharmacy Authority?
Thank you, Abby. And it is a really important question. And I mean, as I've spoken about before, pharmacists, we have to be, as John said, we're relied on for our reliability, our accuracy, but the volume at times can just be overwhelming. I remember as a young pharmacist, newly registered, and I was working in a community pharmacy in a regional town, and there would typically be 300 plus prescriptions a day, many of them coming from a GP practice right next door where there was 2 GPs. On top of that, there was the pharmacy participated in the opioid treatment program, and there would sometimes be about 20 clients who would be presenting typically first thing in the morning at the same time as everyone was coming through from the GP practice next door. And once I worked through all of that, then in my lunch break, I was then checking Webster packs for multiple residential aged care homes nearby. And then in the afternoon, when a lot of this activity, you know, sort of sometimes then quietened down, there'd be me and a junior on. And I think this is, I mean, that was, you know, 15, 20 years ago. But for many pharmacists, some of those working in community settings, or, I mean, I was also a chief pharmacist in a regional hospital where we had a small team and a growing hospital, where at times there was, you know, less than 10 pharmacists for a 350 bed hospital, and looking at all the different activities that you'd have to do, from medication, best possible medication histories on admission, to medication optimization, to, you know, discharge planning and processing. So I think what I think is fundamentally, pharmacists are, we are always relied on, but we're not properly recognised or remunerated. And often the circumstances that we work with, as John said, sometimes there's structural barriers as well. So it could be, and I think that this is something that, if pharmacists are very highly trained, they have a level of knowledge and expertise which so many people draw on, but so much, whether in community pharmacy, I mean, I know when I first registered, they were talking about, you know, cognitive services and pharmacists being remunerated for services other than just being linked directly to dispensing. And I know in the hospital system, and conversations I've had about pharmacists working under the hospital award, at least in New South Wales. So I think there really needs to be, and I saw reports, and it really saddens me to see pharmacists now as new graduates are sometimes, I mean, highly employable, but not properly recognised for their expertise. So I think there does need to be, and you're right, I mean, in Australia, the way that health is set up and run, you know, that there's the responsibility from the federal government, the responsibility from the state government, but I really think there needs to see pharmacists coming out now, working in more demanding circumstances, and being less supported than when I graduated. You know, for me to see that across the profession, and to see most pharmacists now are young or early career professionals, you know, and we want to see pharmacists with that expertise and knowledge to contribute to our health system, you know, within their communities and across Australia. And we need to properly support them in order to do that, so that they, you know, and often pharmacists will say to me, you know, it's not necessarily about, you know, my salary overall, but I just want to be able to do my job and see all the patients I need to see, but I can't do that at the moment. And we're talking before about moral hazards or psychosocial hazards or injury. And I think that for pharmacists and for so many people working in caring professions, and this week I've heard from aged care nurses, from primary school teachers, and it's a similar sentiment that they're expressing. One of them said, you know, I trade off a pay increase to be able to have another co-worker. And I think they should have both. I think they should have a co-worker and be properly recognised for what they're doing. But I think that is, and to see, and there was another question about this primary healthcare reform steering group that's just been established. And there's not, I just went through, because I couldn't believe it, and thank you to Jenny for asking the question, but I went through and had a look at all the people who are on the committee, and there's a nurse, there's a speech pathologist, there's a physiotherapist, there's several doctors, but there's not anyone there with a pharmacy background. I mean, one person has at one point been a past director of the Pharmacy Council of Australia, but this is the thing. So unless we have pharmacists where decisions are made, then we're not going to see change. And I think that's what's critical. Pharmacists have to sit where decisions are being taken, whether that's on the board of your local hospital, whether that's, you know, in your local, you know, within your local state or at a federal level. So, I mean, I know we're talking about self-care and pharmacists being overloaded, but one thing I would say to pharmacists, you have a voice, people trust you, you know, please use that voice to elevate these problems, because we really need to see pharmacists properly supported to support the people that they're trying to care for.
Yeah, it's really important to have a pharmacist voice in there. Likely leads on to another question as well. Vanitha, I think this one's been directed to you, but what are ways to reduce stigma of help seeking for pharmacists? And Curtis, I'd love your response to this as well. Might throw to you first, Curtis.
Look, I think it takes for people to speak up about it. It takes for someone coming from, like I said, from a position of quite a lot of safety. I am my own boss. I have partners, but I am my own boss. So I lose nothing by speaking out. As I said, I'm a middle-aged white man in a country set up by middle-aged white men for the benefit of middle-aged white men. It takes people in a role like mine to actually speak up, to then give other people permission to be able to speak up. So I think reducing stigma, and I've had people I respect deeply look at me and go, isn't this all a bit soft? You know, can you believe these people? And at the time, didn't know that I was one of these people who'd spoken up. And I said, well, you'd be surprised at who's needed to get a bit of coaching from time to time. It's not a sign of weakness that we need help. It's a sign of understanding yourself. And so I think what we need is people to actually just speak up, and it reduces the stigma. And when you do that, it gives permission for people to actually feel that. As I said, I've written a few articles, and my main reason for writing the articles was to give people understanding of what some of those concepts are, so that they can actually point to and say, that's how I'm feeling. Because sometimes that's the worst part, is feeling those feelings and not understanding why, and not understanding what those feelings are. And at this point, I'd like to thank Kay for her help in me both getting to this point, but also helping edit all of the articles that I've written, Kay, and pointing out that some of those articles could be triggering for some of our pharmacists who might read that. And so helping to put some of that context into it as well. So that's my point of view, is we just got to put our hand up and say, yeah, it's me too. You know, I've struggled with that as well. So that's me.
Thank you, Curtis. Vanitha, what were your thoughts on, what do you think can be done in that way?
I think it's really important for both pharmacists and the public to be aware that there are more options available than what the pharmaceutical paradigm produces. For example, Tracy has mentioned some of the complementary options that are available. And we know that pharmacists are inundated with, as they say, more than 200 scripts in some cases. So it's really a matter of actually considering options available to pharmacists in terms of operational demarcation. If they require additional staff, they might need to allocate that time. But also, from a community perspective, it's a good idea to consider, complementary therapies that might be of use. And as John had mentioned, is really taken, John, as well as Curtis, is really taking into consideration where you are at and strengthening where you are at mentally in order to be able to help others as well. So I guess it's operational processes, it's complementary or access to complementary support, as well as when to actually reach out for psychotherapy and psychology assistance as well.
Abby, can I chirp in here?
Of
Everything
course.
I've heard so far has been about what the individual suffering the stress might be able to do, and that's incredibly important. I don't want to take anything away from that. But the question arose from a pharmacy where there was a massive work number of prescriptions. There's a proprietor there, there's an owner there, and a manager. And I would like to just reflect for a while on what their position is in this. Now, people don't go out to really just hurt others, but through their actions, through their ignorance, through their lack of knowledge, harm might arise, stress might arise for others. And yes, we could pass regulation that says there's a maximum number of prescriptions per day that a pharmacist is expected or required to dispense. Michigan in the United States has done that, one of the few places to do that. But of course, it raises questions of how do you measure and whether there was support staff and how long was your day, all those sorts of things. What I think is incredibly important here is to have our pharmacy organisations and our proprietors recognise there are two levels beyond regulation that could come into play. One is tort law, where, as Helen Lowy has put into the chat, things like psychosocial stress are now being introduced into occupational health and safety issues. And proprietors need to know they could be held accountable and face judicial court systems if they actually stress people through excessive workload. And then, of course, there's litigation. And I don't know whether any of you heard, but there was a pharmacist in the United States over the weekend, it was reported, they received a payout through the courts because their proprietor had done a number of things, including obliged them to work through their work hour without a second pharmacist present, not funding them for their training that was obligatory in life. That pharmacist, and I hate the United States for this, was given 36 million Australian dollars payment. Now, you know, we don't go anywhere near there. We are not a litigious society. I wouldn't like us to be. But just as Australian regulators learnt from when there was the problem in the United States with contamination in injectable preparations made in a compounding pharmacy, we will learn from that sort of litigation happening in the United States as well. So proprietors, employers need to recognise they've got an obligation, and that's critically important here.
I'll just add to that I think the other aspect is patient safety. And everything we handle, there's that risk of making a mistake, not picking up an interaction. And I think that it's really important to bring patient safety to workload. And when you're discussing, you know, as an employee pharmacist, when you're discussing workload, it's really important to emphasise the impact of workload on patient safety and the potential for adverse outcome and the, you know, liability that goes with that.
I think that's a great point, and I actually have a question for both UK and John, but developing on from that, how do you think workplace culture can be improved? Because as a young pharmacist, I don't want to rock the boat. And you kind of go into it with that mentality of you don't want to bite the hand that feeds you. And we've actually got a question in the Q&A box as well about, you know, if you're a hospital pharmacist, you get a lunch break, but if your pager goes off or your phone goes off, you need to answer that. And then you don't end up taking your full lunch break. And Emma, like you mentioned before, checking Webster packs during your lunch breaks, and you've shown your commitment to the role, as Elise has popped into the question box, but you need a couple of minutes and you can't take that because you're the pharmacist, you're in charge. You can't leave your computer if you're forward dispensing or if you're on the floor, like you're not able to walk away. So how do you think that culture can be improved?
I think some of it is about respecting yourself and valuing yourself, because if you're going to perform well as a pharmacist, you need to be able to take breaks to refresh, to recuperate, and to be able to go back and keep working. If you don't eat well during the day, if you don't take, you know, adequate water, if you're not taking toilet breaks, if you're not taking a few minutes for yourself, your concentration will wane. And again, it becomes that risk to the public. And this is where, you know, it is so important. I think this is where we've got potentially the pharmacy board on our side, because if we can show that workplaces are unsafe, it's in their interest to support those changes with regard to patient safety. I mean, they put a lot of emphasis on that. Unfortunately, the way they tend to work is to look at the individual registration of a pharmacist, but potentially they can also, or they do produce guidelines around things like workload. Now, I know that, you know, there is that level of dissatisfaction with 150 to 200 scripts a day. And really, you know, that does depend on what else is going on in the pharmacist. And this is the difficulty there is, as John mentioned, in putting figures on these workloads stats, but it is all around focusing on patient safety, but also self-respect And if you don't set up those barriers, if you don't say, I'm on my lunch break, you know, and offer an alternative to whoever is contacting you, whether you're in the hospital pharmacy and, you know, you're on your lunch break, or can they take that urgent order down to the pharmacy and have it dispensed themselves rather than you interrupting your lunch break? Or if you're in a pharmacy, you know, offering for people to come back in 30 minutes when you're not on a lunch break. So sometimes it is a matter of taking a stand. And I know that's very easy for me to say at my stage in the career and much harder for an early career pharmacist, but it's taking those stands that will change culture. We've moved away. There used to be a real culture, particularly among locum pharmacists, as to how many scripts they could dispense in a day. And it was like a badge of honour if they could dispense large numbers of scripts. And I'm glad to see that's going. I'll let someone else have a word.
I will address this in 3 stages very quickly. To a certain extent, it's a supply and demand issue. The more that pharmacists are in demand, in other words, there is a shortage of pharmacists, the greater their employment benefits and conditions will improve. Now, it starts when you first, as a young pharmacist, accept a role in a pharmacy. If you took a role in a large organisation, you would have an engagement letter, a contract of employment. There's law around this. And you've got to be confident enough to recognise your value to the person who's offering you the job and to incorporate into your discussions with them the question of cover for lunch breaks and the like. What are your conditions of employment? Then during your time of employment, if those conditions are not satisfactory, if you don't get the lunch break, you've got to be able to elevate your concern. And it's a classic case of elevating an issue. Initially, it's a conversation that can be subsequently documented, raised initially with your immediate supervisor, going up to a higher level if need be, before you take it outside. And of course, the third stage is, if this place is not working for you, you've got to question why you are working in it. And if you take your employment away, that's a problem for your employer. There's a cost of recruiting and replacing you. And you've got to value yourself and value your contribution to the place. So treat it as something you have to address before you start work, during there, and recognise that you do not have to stay there, because pharmacists are valued and in short supply.
If I can jump in there as well, we also, another part of this relates to time off, actually being away from work. And we use a messaging platform called Slack. Now, the reason I chose Slack was simply because I, as the boss, can actually set a do not disturb time for all of my staff, which I've set from 9 p.m. to 6 or 7 a.m. I forget exactly what I've said. And I've actually encouraged all of our staff to set their own do not disturb time. So if they don't take the opportunity and set their do not disturb time, and I have a crazy idea in the middle of the night that I need to get out straight away, then I can do that knowing that it's not going to ping on somebody else's phone in the middle of the night. And they can do the same. And I've got my own do not disturb set on that as well. So we chose Slack for that reason, that I don't want our staff, when they're not at work, to be thinking about work. And we set up the expectation that they would check Slack as they prepare for a shift. Now, they can decide whether that's when they're lacing up their shoes, whether it's when they're just about to scan their fingerprint in to start a shift. They can decide when that is. But all I need them to do is check Slack for any new messages before they start any shift. And as far as I'm concerned, they're up to date. So it stops that being away from work, but actually still being at work stuff. And again, choosing Slack as opposed to something like WhatsApp. We all use WhatsApp for family, for friends, for all sorts of things. So it's really difficult to stop work intruding through WhatsApp. And we chose Slack for that reason.
Does that replace your diary in the dispensary, Curtis?
No, of course not. No.
I don't think anything could ever replace that.
Yeah. But it is it is a very good way to get information out quickly. We had, there seems to be an emerging problem coming out with angiotensin receptor blockers, sartans. Seems to be an emerging problem coming out with a recall that sounds very much like ranitidine a year and a half or 2 years ago. So there was a bit of messaging that went backwards and forwards yesterday, but that, you know, that's a Sunday, and I don't encourage that, and I try to actively discourage that. But at the same time, people know that they can put up a message on Slack knowing that the other pharmacists will catch it before they actually log in for another shift. So.
And it's like when something becomes authority out of the blue, like our asthma inhalers and also reflux medications within the last 2 years as well. It's always good to know that before you turn your computer on for a shift. Tracy, I have a question for you actually. So as someone who's worked adjacent in pharmacy for a number of years, how do you find mental health literacy amongst your patients that you see in comparison to patients who are coming to you who are already taking pharmaceutical medications for their mental health illnesses?
That's a great question. I see it that there is absolutely a difference. So I work as a naturopath in a naturopathic clinic, and I see a fair bit of mental health coming through with that. It's often a factor, and with those patients, it's usually I would like to avoid the medication pathway, as opposed to when I've worked in pharmacy, and that's when working in pharmacy, it was always, I'm on this medication and what else? And the literacy around understanding that we call it a pill for an ill, and whether that's a complementary medicine or a pharmaceutical medicine, complementary medicine exactly the same. There's no, particularly when it comes to mental health, but it's true for most conditions, there's not a simple pill for the ill. And the idea of I'm on an antidepressant medication or an anti-anxiety medication, and what else? What they mean is what else? What complementary medicine pill can I take, as opposed to what can I add to my diet or take away from my diet, or how can I move most effectively? Will drinking more water help me? As opposed to those who are looking to avoid a medication route, I'll often prescribe some complementary medicines alongside lots and lots of lifestyle interventions, and they'll be reluctant to take the complementary medicines in favour of the lifestyle interventions for the long-term health benefits. That's my experience. Yeah.
That's good to know. And I think we're always taught as pharmacists that like lifestyle goes hand in hand with medications. Like if you've got high blood pressure, you need to, fix your diet, get some exercise in, do all of that in conjunction with taking the medication. And the aim is to hopefully, if you're stabilized enough, reduce your dose or come off a medication.
Absolutely. And I think that's a really good point when it comes to the amount of contact that a patient has with a pharmacist, and the trust that the community at large have with pharmacists over any other health profession, any other profession really. I think that them and nurses fight it out. And then you look at the statistics of, say, post severe heart attack or other coronary event, of people who go back to their lifestyle that led to the event, within 6 months, 12 months, as an example. But it's all sorts of conditions that the lifestyle interventions are just not maintained. That the role of the pharmacist to help someone hand in hand is so important. I think to help maintain the energy of why am I moving every day? Why didn't I stop smoking? Why didn't I do all these things? Can't you just give me a handful of pills to keep me better? That understanding of the why for patients, that's in my clinic. I spend I reckon 90% of my time talking about the why, not the what.
Yeah, I think it's something that universally you need to fix the habit before putting a Band-Aid on it too. A question for our group in general. So I work in insurance for WorkSafe in particular, and we have lately been dealing with a lot of stress claims. And the thing that always comes to mind is I'm surprised there's not more pharmacists putting in stress claims. especially now with COVID-19 and everything that's been happening. And I think, I'm not sure if you guys remember, but back in, I think, April last year, 2020, Nando's put out a thing where they were like, if you're a frontline healthcare worker, so a nurse, a doctor, a paramedic, all of whom do fabulous work, not taking anything away from them, you guys can get something free as a part of your meal. And I remember a lot of my friends that were like, why aren't we remunerated? Like, why aren't pharmacists recognized? What do you guys think in general, and for the group, that what recommendations would you put forward to helping mental health as a pharmacy, but also helping people understand that mental health in pharmacy is a massive issue that does need to be taken quite seriously as well, especially when you feel like your work isn't being recognized? And I know that's not why you get into the field, to be recognized, but it's a nice cherry on top of the cake sometimes.
I'll start. I don't think that as a profession we've done a really good job at helping the community to understand what our role is and how we can help, and that we are a health profession. And I think that that's a long-term situation. It's not something that's going to change, but I think it's very much around individual pharmacists and their own community and creating expectations when people come in. And you mentioned too that, you know, pharmacists don't make a lot of these insurance claims. And I think really, I mean, to some extent, that's a compliment to pharmacists because they are very resilient. But at the other end, we also hear from a lot of pharmacists who are very burnt out and they lose their compassion and empathy, and they become not able to really work as a health professional in an appropriate manner. And unfortunately, you know, we do encounter pharmacists out there who get to that stage. And I think that, you know, that is something that needs addressing, is, you know, discussing burnout and raising awareness in the profession and looking at preventing it getting that far. And, you know, that sort of awareness raising comes through cultural change and promotion. And I mean, to some extent, that's the work of PSS in the, you know, in the future. And this is, you know, an area that we really want to focus on, is not just picking up people from the bottom of the hill when they've jumped, but to actually stop them going to the top of the hill in the first instance, to actually look at how we can create more supportive workplace environments and supporting, you know, our colleagues, particularly in those early years when everyone's on a steep learning curve. And I can see that John's ready to jump in, so I'll stop there.
Thanks, Kay. Abby, I just wanted to make one comment about your suggestion there that we don't all go into this to be recognised. We probably don't all go in to be recognised, but almost every psychological attribute of us likes some recognition. And whether it's just saying thank you to our staff or our colleagues because they've gone that extra mile, or whether it's, you know, every now and again, a gift, granting somebody a day off, a ticket to the movie, it can be quite small, but a thank you can go a long way, because being recognised is really where a lot of this starts. But I'm going to take the opportunity while Emma's here to make a further comment that I think is relevant to this. At the moment, we are still in a paradigm where the drug is what's funded largely. And we need to move to the point where the pharmacist is remunerated for their professional role. And if that is the case, it changes the paradigm. My expertise as the pharmacist caring for that patient, whether it's dispensing the drug or treating them, you know, in the front of the pharmacy for over-the-counter some process, if I am recognised and remunerated, rather than it be the drug that I dispense that has the value, I have the value and I'm remunerated for it in the health system, that would help too. And I think that's a critically important underlying factor here.
Thanks, John, and thanks, Kay. And there was two things that immediately come to mind from people that I've heard from. in terms of going back to the point about making a stress claim, I've heard from many healthcare professionals who are reluctant to make any sort of claim because of the potential impact on their registration and their ability to practice. And this is broader than pharmacists, but I've heard from many who have that hesitancy. And that, when I was talking about earlier, even that then can mean a reluctance to seek help in the first place, whether that's going to their GP and getting a better health plan, or being referred to a psychologist. So I think there's for many healthcare practitioners, there is a concern that even though these are supposedly confidential, but there is a hesitancy that they think that this confidence might be breached, that then there'll be question marks about their capacity and therefore their ability to be employed and to do their job. So that's one part, I think, in terms of why there is fewer stress claims that you might see from pharmacists or other registered healthcare professionals. The other one, I met with Dr. Sam Harvey, the chief psychiatrist from the Black Dog Institute last week, and they've got out a paper about modern work and some of the features of how the changes in the way that we work in Australia are impacting our mental health and well-being. And the thing that most struck me was when we're thinking about pharmacists, and particularly that we've got a younger profession, was that mental health symptoms have gradually increased in workplaces across Australia in the last decade, but most apparent has been amongst younger workers, particularly around age up to about 25. And that what we've seen is that's been exacerbated by COVID. And I think so when we look at pharmacists and we look at their experience through COVID, I think that is what we're likely to see. And talking to Sam, what really troubled me was that there's been a lot of discussion about how our rates of suicide haven't increased. And Sam discussed suicide sometimes as a lag indicator, that we may then see that increase after. So I think that looking at it more broadly, one of the things that they were talking about was kind of insecurity in work, and that has had a big impact more broadly, the increase in casualisation, the lack of permanency, and that has affected a lot of workers in Australia overall. John, to your point about being paid for what we for us as healthcare professionals and it not being linked to dispensing, that was in the chat. I think Jenny mentioned that very early in the chat. And it is really important that pharmacists are recognised for our knowledge, our skills, our professionalism. And I think that I know when I first registered as a pharmacist, and I was talking about, John Bell was talking about forward pharmacy, and you look at different times of what's happened over my 20-year career in pharmacy, to being able to now have consult rooms where we're doing things from immunising to sleep apnea clinics to diabetes management. So I think for me, I would really like to see pharmacists to be able to work to the top of our scope of practice, to be able to fully use the knowledge, skills and training that we have to really get that professional satisfaction from what we do. And that's a kind of recognition, John, in a way, is what you're talking about. But you're absolutely right. Linking pharmacists to dispensing volumes probably goes back to Kay and those badges of honour. I remember when I was working in doing some locum work myself, and people would say, I did 350 scripts a day, and there'd be a sticker in the dispensary which had, the top number of scripts dispensed, and as we come up to Christmas and people getting their rest. But yeah, so I think, there is a lot to this, but I really think that that pharmacists as caring professionals who enter into the profession to do things because they want to work with others and they want to help people, that needs to be properly recognised in the conditions that they work in, and in the way that they're rewarded and recognised for that.
Oh, that's really great. Unfortunately, we have reached our time. There are a couple of questions in the Q&A, but what we will do is we'll send them out to our panel members and we'll ask them to answer them for you guys, just so everyone can get a full answer to the questions that they wanted to ask. But thank you to all our wonderful panelists and for the insightful discussion today. On behalf of the Mental Health Foundation Australia, I would like to thank all of our speakers for participating in today's event. And I'd also like to thank our sponsors, so Australian Unity, Chemist Own and Foot Solutions. and for all of our guests and all of your support for everyone watching today. Thank you so much, and we hope you enjoy the rest of our day. We do have a couple more events before the end of Mental Health Month, so jump onto our website or our Facebook or Instagram to see what's around the corner. Thank you.
Stay safe and be well.
Yes, of course.